the topic selected is somewhat different, as I'm working on menopause since last so many years, and I have observed that after attaining menopause, what are the problems females have to face? During reproductive years, they are coming to us for a menstrual problem or for the problem of infertility or some other problem related to reproductive system. But what is the, you can say, what is the role of reproductive system after menopause to be responsible for other disorders that I have seen in my patients? So thought to discuss that during, we can say, reproductive years or adolescence, females, girls are coming to us with the problems of PCOS. For I have observed that for only if they are having cosmetic reason, they comes to us, or if they are having problem of infertility, then only they visit to us. For menstrual problems, they just take some pills or some other medications and they pass their reproductive period only. But PCOS is having impact upon her later life, or we can say postmenopausal life, and that is sometimes very we can say painful, and we have to make them aware for that your lifestyle, your disorders of reproductive age, how they have impact upon your postmenopausal life. So it is somewhat different. Hope you will like to have discussion or to listen to this topic. So I would like to share my screen. Okay, now that you all know that polycystic ovary syndrome, you all know that what is it and how it affects in the, as I told you, that reproductive age as well as adolescence as well as menopausal female, and throughout her life, health, you can say, or quality of life across the life course is affected by this disorder. And it is most common, we can say, endocrine disorders being represented by various signs and symptoms. There is broad range. We can see signs and symptoms related to reproductive system, endocrine system, and metabolic alterations also. And phenotype can change. And according to that, it requires some, our diagnostic approach and treatment should be personalized. In each and every patient, you have to make some personalized treatment protocol, or we can say customized treatment protocol. But as I have told you that after attaining menopause, this type of syndrome evolves from reproductive disease to more metabolic disease. More metabolic problems are seen in postmenopausal females. Manifestation of PCOS, you all know that sometimes oligoovulation, sometimes anovulation, sometimes associated hyperandrogenism, or after investigations, you can see that polycystic ovary is there. It means it is a HPO axis dysfunction along with anovulation. But other causes of anovulation are having different feature other than PCOS. PCOS is typically has, we can say, androgen axis and some subtle alterations in serum levels of gonadotropins and estrogens. And we have seen that it is having origin in the intrauterine environment. Bija dosha, kshetra dosha are also responsible for this disease, and it is now proved that some genetic components are also involved in the manifestation of PCOS, which that girl or that female has to face in later life. So, influence of some other factors which modern science have elaborated in view of research or changes going on found in her body are interleukin 6 and interleukin 10 gene polymorphisms and interferon C and transforming growth factor beta 1 may responsible for the PCOS. It means if interleukin 6, as you all know, that is related to chronic inflammation in women. So low grade chronic inflammation in women with PCOS can be involved with the pathogenesis of type 2 diabetes mellitus and cardiovascular disease. Get my point? If there is inflammation, interleukin 6 will be there, and that will be responsible for type 2 diabetes mellitus as well as cardiovascular disease. Why? Interleukin 6 is a major pro-inflammatory cytokine in chronic inflammation, and it is closely associated with insulin resistance and cardiovascular anomalies. Obesity. We all know that obesity is related to type 2 diabetes mellitus, or we can say it is a risk factor for diabetes mellitus. But it is also seen that it is associated with the elevated level of interleukin 6. Why I am discussing this IL-6? That when we are doing research or we are treating the patient, it is seen that if you investigate the female, interleukin 6 is elevated. After giving treatment to the female who is having PCOS, interleukin 6 level will be decreased. It means it is related to PCOS pathogenesis. It can be useful biomarker to assess the result of your treatment. If patient is having capacity to pay, or you are having all infrastructure, so many PG scholars are, I think, may listening this lecture. So if you plan any research topic for PCOS, you can also take this interleukin 6 as biomarker to assess the results in the patients of PCOS. As it is not an interesting characteristic, but it is useful in monitoring the treatment protocol. Whatever you have given the treatment to patient, and if you assess the interleukin 6, it will be reduced. It means your treatment has worked. I will discuss on which principle of Ayurveda this result is being assessed, or result you are getting in your patients. So IL-6 is also seen in the patients having cardiac, or we can say cardiac issues, and after 4 months of treatment it can be reduced. So it means it is related to inflammation. So early intervention in the inflammatory cascade may help you to prevent your patient who is entered into menopause. We can say that we can save that patient from cardiovascular problems. Now, interleukin 10. What is it? It is multifunctional cytokine, which is having immunosuppressive and anti-angiogenic functions. It can tumor promoting, it can be tumor inhibiting. So it is having both the properties. Interleukin 10 is having both the properties. So lot many researches are going on, and these researches have elaborated or concluded that gene polymorphism or of this interleukin 10 affect the secretion of IL-10, which will have relation to immune response to the chronic disorders. Another factors, causative factors of PCOS are epigenetic exposures, which can highlight the intrauterine exposure, you can say maternal androgens, or phenotype. You can say that Matrich, Ahar, Vihar, or Kshetra, or Bij, these are also responsible for PCOS. You all know that these are related to PCOS. And after that, in the PCOS patients, we are seeing that there is some variations. Like according to Desh, you will find some variations, or according to their ethnic, we are having variations. Why these type of variations are there? These variations are associated with environmental factors. In which environment your patient is living, what is her socioeconomic conditions, which lifestyle she is following, all are responsible for the different manifestations of the PCOS. And insulin resistance, well, you know that insulin resistance is also important, we can say, pathophysiological element for the development of the PCOS. And another is hyperandrogenism. We see in our patients that manifestation is in the form of hyperandrogenism. But in menopausal female, or when female is going to the menopausal transition, we have seen that this hyperandrogenism, or you might have seen that in your patients who are entering into menopause, hyperandrogenism is seen being persisted after menopause also. And this is you can say, all the responsible factors of the manifestation of the PCOS. Testosterone, we can say aromatization of androgen to estrogen, and premature atresia of the ovarian follicle, and that results into anovulation. And due to anovulation or multiple ovarian follicles, due to excess estrogen, endometrial hyperplasia and neoplasia can happen in the patients of PCOS. That is common manifestations. But some other, we can say, manifestations or features in the female who are having PCOS, other than reproductive system, are, as I told you, that insulin resistance, some metabolic syndrome, or low-grade chronic inflammation are also seen in your patients. So, variety of these metabolic disturbances may be related to higher risk of developing cardiovascular disease. Get my point? Why I am discussing this? This extra reproductive manifestations, if patient is having metabolic syndrome or low-grade chronic inflammation, what will happen? If continuously or for long period, longer duration, if these are present in the patient who has already attained the menopause, which she was having PCOS also, she may have, or she may is at risk of cardiovascular disease. It means I have searched lot many papers, and this lot many researches also, you can see that polycystic ovarian syndrome is high risk factor for cardiometabolic or cardiovascular disorders. And generally we see that PCOS females are young, but In perimenopausal females also, we have to focus on we can say that which manifestations are there in your patients, like she is having diabetes or CVD or anything. For that, you have to start counseling from the age of 35, which we are doing at our institute, that after the age of 35, to have healthy menopause, we have to start counseling of the females. But for that, in the PCOS patients, especially, we have to examine them. Generally, what patient says that she was having infertility, she was having PCOS, now she has conceived, now no need to treat the PCOS, or she is not bothered about that. But we have to make aware all the females that you are having PCOS. In future, after 10 years or after 15 years, when you are going to have your menopause, you may be at risk. That we have to explain them. Like future cardiovascular disease, and we have to make prevention strategies for those females, and we have to explain them what you have to do. And we have to make them aware that you have to keep your close observation upon dyslipidemia, hypertension, or diabetes, or any metabolic syndrome. If you are having, you should be conscious. You have to be aware about your problem. So CVD markers like coronary artery calcium scores also being advised to our patients. We advise that you have to go for that. You have to have investigations like CRP or carotid intima media thickness, and endothelial dysfunction are the main, we can say, that increasing factor in our patients who are having PCOS. Like dyslipidemia, most common lipid abnormalities in the patients of PCOS. These levels will be elevated, like you can say triglycerides will be elevated, or low density lipoprotein cholesterol, LDL-C will be elevated, or VLDL-C, very low density lipoprotein cholesterol, and low high density lipoprotein cholesterol levels. These are all deranged in the patients of PCOS. It means she is having dyslipidemia. So you have to make her aware that you be aware about your lifestyle. You do change in your lifestyle, and mechanism of obesity also should be, or we can say, explain to our patients that there can be overproduction of VLDL due to your lifestyle, or abnormal lipoprotein lipase mediated lipolysis is there due to your lifestyle. We have to explain them that how and why you are having this problem. Counseling is must. So insulin resistance also is linked to hypertriglyceridemia. And for that, some hepatic production of ApoB is responsible, which is having VLDL. Right. So some researches have done that if we give our patients to flutamide, that is androgen antagonist, resulted into lipid profile are reduced. It means if it is given to the patients of PCOS, lipid profile will come into normal range. It means dyslipidemia is related to PCOS, and it can be related to cardiovascular problems. Second thing, you see that in this diagram, it is mentioned that primary mechanism for insulin resistance may be involved in the increase of serine phosphorylation, which causes post-binding defects in insulin signaling. You can see in this diagram. And secondly, impairment in the tyrosine phosphorylation of insulin receptors. And insulin receptor substrate 1 affects metabolic pathways in ovaries. And by this, she may have increased risk of type 2 diabetes mellitus and decreased glucose transport 4. However, we can say that close monitoring with screening for this type of symptoms or type 2 diabetes mellitus of your patients may help to avoid this type of problems in your patients. Now, second thing is hypertension. Hypertension, or you can say that hypertension in women with PCOS may be through the imbalance in the autonomic nervous system, increased renal sodium reabsorption, as well as reduction in the production of nitric oxide. That is very much important. And here I have quoted that coronary artery calcium. It is very much important. In some research studies have done, and they have compared to normal females what was the ratio of coronary artery calcium in the females of PCOS in comparison to the females who are not having PCOS. Right. Same as prevalence according to the age group. See, 40 to 61 years in the females, 46% was reported coronary artery calcium, and carotid intima media thickness was seen higher in the women of PCOS. Means increase in CIMT in the female of PCOS has been, we can say, related to higher level of circulating insulin. It can predispose circulating total cholesterol, LDLG, TG, CRP, interleukin 18, as well as lower level of HDL-C, and so as to abdominal obesity. Now, important pathogenesis is endothelial dysfunction. It is influenced by the elevated level of markers of inflammation. It means it supports that chronic inflammation contributes to endothelial dysfunction. Remember, inflammation, shoth is there. When there will be shoth, there will be dysfunction. We see in our patients also, in any part of the body, if there is shoth, there will be dysfunction of that part. Same as pathway, if there is inflammation, that pathway results into endothelial dysfunction, and that can be due to insulin resistance also. As you all know that insulin, what do? Insulin exerts vasodilatory effect, right? That occurs secondary to the release of endothelium derived nitric oxide. And insulin resistance is associated with reduction in the synthesis and release of nitric oxide, as I told you earlier. And that will enhance the inactivation, or we can say insulin resistance will inactivate. If nitric oxide is released, it will be inactivated by insulin resistance. And that causes constriction. And this constriction will result into vascular stiffness. So vasodilatory action of insulin is seen in the women of PCOS. Getting my point now? See this classification. How PCOS is related to cardiovascular disease risk. This is latest, we can say, groups or division of the manifestation of the PCOS patients. As per the phenotype of PCOS, the risk of CVD is different. So they have distributed as phenotype A, phenotype B, phenotype C, and phenotype D. So menstrual irregularity, hyperandrogenism, generalized and abdominal obesity, and insulin resistance are more pronounced in the women with, you can see that they are having phenotype A and B compared to those diagnosed with the non-classic PCOS, that is phenotype C and D. So ovulatory PCOS, phenotype C, you can see that ovulatory dysfunction is seen in phenotype C. It is associated with lower BMI, lower prevalence of obesity, lesser degrees of hyperandrogenism, and hyperinsulinemia. In addition to lower prevalence of metabolic syndrome and milder form of dyslipidemia if there is patient of phenotype C. So according to phenotype, we have to advise to our patients. So global CVD risk also should be routinely assessed in the women of PCOS, that is concluded by a study. That if patient is having obesity, history of IGT, gestational diabetes, family history of diabetes, or family history of hypertension, those females should be screened by GTT, or you can say that oral glucose testing. And along with that, lipid profile, blood pressure, weight should be monitored regularly. This is preventive aspect, or we can say awareness program in the females who are having already PCOS. And if you do this thing, it can help to your patients to be, or we can say that they will not have such type of disease, or they will not have CVD, and they will favor your patients. But some studies are also say that it is not that much related to reproductive age group. So chronic condition which must be managed throughout the life of a female. I also already told you this thing that impaired GTT, everything should be assessed in your patient during menopausal transition. So during menopausal transition, we see in our patient that androgen levels are known to remain stable or even to increase as women enter in the menopause. But estrogen level decrease dramatically as there is no ovulation, so estrogen will be reduced. And as women become more androgenic, insulin resistance, chronic inflammation, abdominal adiposity, dyslipidemia, that will be worsen in your patients. And adrenal androgen secretion will be pronounced in the patients of menopause. So long-lasting hyperandrogenism may magnify the unfavorable hormonal and metabolic changes related to menopause. And due to that, female will be exposed to health risks. And for that, some investigations are being advised to patients that they should have such type of investigation, that is HOMAIR, that value is always high if compared to females who are not having history of PCOS. You all know that in the PCOS patients, AMH level is always high in the comparison to females who are not having PCOS. So that also can be correlated with antral follicle when you are doing examination of your patients. So without PCOS, I already told this thing to you that AMH level is already high in your patients. It means if AMH level is high, there will be follicle in the ovary. So those female who are having AMH level high will be having menopause 2 years later. It means females who are having polycystic ovarian syndrome will enter into menopause 2-3 years later than other females in the comparison of other females. And metabolic syndrome, I already discussed that lipid metabolism will worsen and unfavorable lipid profile will be seen. So we have to examine all the things in our patient, that weight, circumference, cholesterol, triglyceride levels. We have to examine in the patients when they reach at the age of 40. During 40 years to 50 years, you have to keep watch upon these levels, or you can advise to your patients that after age of the 40 years, do annual examination, do annual investigations of these and these things, and keep control upon your waist circumference. Otherwise, you may have cardiovascular problems. So, many studies are being going on after the age of 35 years, and they have seen that these levels are somewhat higher in the patients who are having PCOS. So in our institute also, we are doing awareness program in the female who have crossed 35 years of age. After the age of 35, we make them aware, we prepare them for coming menopause, that you are approaching to menopause. So according to their prakriti, we explain them, we can say we can teach them, how to examine your prakriti. We teach them, examine your prakriti. According to prakriti, you follow diet and lifestyle to be happy, to be healthy after the menopause. And climacteric symptoms, we explain them. You may have such and such type of problems after the age of 40 years. So keep watch upon those symptoms, and according to that, take care of you. So, and this I already told you that androgen levels after menopause, if higher, it may have cardiovascular risk remains increased and affects the morbidity. Right. So constant long-term exposure to elevated androgen levels, female will have this type of some dermatological components also. The hair will be lost. They may have balding. They may have some dermatological problems after attaining their menopause. So, in short, I will explain you that risk factors in the females who are having PCOS and what can be the risk factor to menopause. So, take home some points. I will explain you, and then I will jump to management portion also, that with which principles I do treat to my patients who are having PCOS, who are entering into the menopause. So first thing, that PCOS does not disappear as women get into menopause. Remember, first thing. Right. Secondly, lipid profile in women with PCOS differ from those in women without PCOS after menopause. There will be difference. Third thing, females who are having PCOS reach menopause a few years later. Right. Third thing. Fourth thing, that inflammatory and metabolic parameters, like I discussed in detail, that interleukin and all, that will worsen with age. And they put women in the increased risk of lifelong health issues after menopause. So we can understand that why females are having CVD after menopause, why they are having type 2 diabetes or arterial hypertension. Those all are related with their health of reproductive system also. And that should be taken into consideration. So now what to do? Counseling, screening, and management options. 3 things we have to do. First thing, counseling. Second, screen the females that on which point you are going to explain them. Third thing, what management options you are going to advise to your patients. Which type of supports you are going to give to your patients by their dietary modifications or lifestyle modifications, what you are going to advise to them, and which type of metabolic complications may they have, that we have to explain to them. And for that, I always prefer, or I always explain to my patients that Ritu Sandhi Shodhan should be started from the age of 35 years to remain healthy after menopause. Right? Rasayana Aushadhi should be started from the age of 35 years. And being clinician or consultants, what we have to do, we have to focus upon Rasavasrotas, Raktavasrotas, and along with that Pitta also. Always we think that PCOS is Vata Kafaj Dushti. But I have seen that it is Tridoshaj Dushti. And in some patients, there is Pitta Dushti also. So we have to keep focus upon Pitta also, as Pitta can be responsible for their postmenopausal problems. So watch upon all the 3 doshas. And very important, stress factor also should be assessed. And for that, we advise Shirodhara to our patients. It is our, we can say, treatment protocol, part of our treatment protocol of menopausal females, that we advise them Shirodhara also. So now, as I discussed with you in detail about interleukin 6. Interleukin 6, when raised, think upon that it is short, right? So, Shwethu Chikitsa, mentioned in Charak Chikitsa 12, may give result to your patients of PCOS if you are going to treat your patients. And Charak Acharya has mentioned Langan, Pachan and Shodhan. And Tiktagrit is mentioned in the Chikitsa of Shodha. So if we give Tiktagrit to the patients for PCOS, if you are planning Shodhan, you can select Tiktagrit also, and that will give result. Some combinations are also mentioned in Charak Chikitsa Sthan, that Trikatu, Trivritta, Katurohini, with the anupan of Trifalakashaya. It is very good combination if you advise to your patients of PCOS, is give excellent results as it gives Shodhan. There is Trivritta, there is Katukarohini, Trifalakashaya is anupan, and I have seen that this combination giving result to the patients who are having Krurakosta. In Rudukosti patients, don't advise this combination Trikatu Trivrit Katu Rohini with Anupan of Trifalakashaya. You select this combination in the patients who are having Krurakost. Mridikost patients, you can select Haritaki with Gomutra, or Haritaki, Nagar, Devdaru and Punarnava. See, so nice combination. Punarnava is also there. So, you know that if there is involvement of Mutravra Sotas also, Kled is also there, there can be Strotarodha. To remove that Strotarodha, this combination is advised. So you can do small research or small study that if in the patients of PCOS, interleukin 6 is raised, if I give Haritaki, Nagar, Devdaru, Punarnava, what is the result upon this interleukin 6? right? Then decoction of shunthi and pitadaru. It is also very good combination. It is also helpful in the patients who are having Bridu posture. Then if patient is having tridoshaj type of manifestations in PCOS, you give shama, erand, black pepper, cinnamon, devdaru, punarnava, ginger and danti. See, very nice combination. And it will definitely give results to your patient. You will not see that this type of treatment is given or is in routine to your patients of PCOS. But on the line of Shotha, as we are understanding in the viewpoint of modern pathology, treatment we are giving Ayurvedic. So understanding of pathology and breakage of that samprapti of modern pathology, we can give such type of medications and we'll get results to our patients. And some classical medications after Shodhan, lot many yoga are mentioned in Shotha Chikitsa. This I have already tried in my patients of PCOS. You can also advise that Gandhirya arist or lot many asa arist I have quoted in this slide. And Faltrikadya arist also is giving very good result. And along with that, you also know that Krishnadi Churna, Ksharagutika, Guda Ardraka Yoga, and especially Kamsa Haritaki, Patol Muladi Kashaya also can be given to the patients of PCOS. But we are discussing the patients who are entering into menopause. To those patients also, you can advise after assessment of probable complications in later life, you can advise any yoga out of this combination also you can advise. If after investigations you have seen that lipid profile is deranged, then focus upon Medavasrotas. And for that, teach patient to have Udvartan at fixed interval, not daily. We advise them Udvartan after 2 months, after 3 months, or thrice in a year. You can advise to those patients who are at risk, who are having PCOS, but may have such type of lipid profile changes after menopause also. In that patients also, you can advise Udvartan, you can advise them Lekhan Basti, and very good Nasya is Trifladi Taila. You give them Trifladi Taila, you advise them to have pretty much Nasya of this Trifladi Taila. In good combination of Guduchi, Musta, Haritaki, Bibitaki, and Amlaki. It means Trifla, Musta, and Guduchi is good combination that you can advise to your patients so that she will not have lipid profile deranged. That will be controlled, and she will. We can help her to prevent the cardiovascular problem. And Pathya also can be advised. And very important thing is modifications in Bihar should be advised to the patients. So, in short, that all these rotas can be involved in the patients who are entering into menopause, but specifically to save the females from cardiovascular problem or other disorders which can put your female at risk, can be prevented by helping them or by make them aware regarding their problems. So in short, I have explained you the things. So you can we can take questions also.